very weak, fatigued, general malaise. She said she went to her primary doctor. When she went to her primary doctor, the doctor never performed an x-ray, and she told her that she had asthma and that she gave her an inhaler and she sent her home. So the lady gets home and she's not feeling well. She's very, very sick. And she calls me. I ordered a chest x-ray where they can go to her home and perform the chest x-ray. I got the results back and the lady had a 6 millimeter lung mass.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Tijuana Temple, a passionate and skilled family nurse practitioner with over 10 years of hands-on experience in diverse medical settings. Her journey began in the fast-paced environment of the emergency room, where she spent 5 years treating a wide range of illnesses and honing her ability to think critically under pressure. Tijuana further specialized in cardiac care during her 2 years in the telemetry unit, where she developed a deep understanding of heart health and patient monitoring. Today, she's the proud owner of a thriving virtual healthcare business, T Temple Family Health, where she combines her medical knowledge with innovative solutions to meet the needs of her community. So Tijuana, glad to have you here and welcome.
Thank you.
So let's dive right into it. How did you first get interested in medicine?
Oh, wow. Okay, so years ago, it's kind of a sad story, but years ago, my father's brother was diagnosed with HIV, and he was afraid to, tell the family. And long story short, by the time we did find out, he was full-blown AIDS. And, we had limited time, and, we spent many days and nights in the hospital. And the nurses there was so compassionate and so loving, and they helped my uncle. They was there for him, and since then, that was the moment I said I wanted to to do healthcare. At that moment, it was a very challenging time for my family, myself, but seeing the nurses come in and doing all that they can do and being compassionate, I knew that that's the direction I wanted to go.
Got it. And so that kind of took you through that whole healthcare journey. And so can you talk a little bit about how you ended up deciding to start your own practice?
Well, actually, I was in, it was actually during COVID when I decided to do it. I was actually thinking to do it before, and I was actually in the process of doing it. But when COVID hit, I said, wow, healthcare, I'm trying to make appointments for myself, and doctors are saying, 3 months appointment time, and at that time I needed to, be seen more quicker. But, the times was very long. So I said, let me start a telehealth company, a telehealth practice, because that way people can be seen at their own, at their own convenience, anytime, any place. And that's how I thought of it.
Got it. And so now that you have this practice, can you discuss some of the most common treatments or reasons that your patients come to you for? And also, why do you think that you get so many of those types of specific patients?
Well, what I'm finding is that I'm getting a lot of mental health patients. Mental health is very, it's a very, very, what's the word I want to say? Very needed. And a lot of times, they can't find the psychiatrist that they need or the psychologist. And so I find that I'm getting a lot of patients with, diagnosis of depression, anxiety, mood disorders. And I think that's a lot of my, my patient base that I get. But, I also get the regular ones like, abdominal pain, UTIs, conjunctivitis, things like that. A lot of medication refills. But I would say that the majority of the patients are mental health patients.
Okay. And why do you think it's they're running into so much issues as far as trying to find care for, I'm talking specifically about the mental health side. Like, why do you think it's so difficult for people to find that care?
I think it's difficult because I think the psychiatrist is actually bombarded. There's a lot of people, a lot of patients that require mental health services, and I just think that it's so huge that it's just not enough providers to actually help these patients, and I think that's what the problem is. These patients, they need their, you have to it's kind of hard because then you have those patients that's drug seeking, and then you have the patients that really need that care, and it's really hard to try to determine which is which. Like, who am I to say, oh, this person is just drug seeking? But when you look at their characteristics and the way that they're, how they make appointments, how often they're making appointments, medications they're calling in, telling you what to order. There's signs that you have to look at. So I think that's what that's what the problem is. It's just that it's so many people with mental health issues, and it's not enough providers to care for them. And that's the same with even primary care, with your primary doctor. It's the same. It's so many people that need that's sick, that need that care, and it's really hard. The primary offices are being bombarded, and it's just not enough. It's just not enough doctors.
Got it. Okay, so you saw that need, and you want to come in and fill that void, help people to
Yes.
really looking for this. Like, a lot of people are looking for this.
Exactly. I wanted to provide people with that instant gratification, where they don't have to wait. A lot of times, most of the times, I would say, when people call my practice to make an appointment, they're getting same day appointments. They're getting their medication refills within maybe an hour or two. So I'm trying to keep that going, because I know how hard it is to get that appointment, and especially when you're not feeling well, and everything is hurting, and you call your doctor and they're like, oh, come in next week, or I'm sick right now, I need to be seen right now. And you do have the urgent cares, but again, the urgent cares is also being bombarded, so it's like you're not feeling well, and you're sitting there for hours waiting to be seen. So that's, I saw all of that by being in the medical field. So I was trying to, I'm trying to build a practice where I can, I guess, better help my patients, I should say.
Yeah, or at least relieve their pain that they're struggling through.
Exactly.
I think that's a great story to tell. I actually have another story about that, because my mentor, he was suffering from, I think it was back pain, like something, he had an issue with his spine, so he was suffering from intense back pain. Like, the only way that he can not be like crumpled up in pain was just to lie down all day. Like, he couldn't even move.
Right.
And so he called a specialist, and the specialist, or the receptionist, said that, oh yeah, we can see you. His next availability is 3 weeks from now. And I mean, he's a very assertive man. So he's like, 3 weeks from now, I'll be dead by then, like, with this.
Right.
So it's like, this is ridiculous. Like, I'm in extreme pain. Like, you can't see me for 3 weeks. Like, that's ridiculous. So, I mean, kind of what you're saying, I think there's so many examples of it. And so now you having your practice, being able to help people same day, next day, very, very quickly to alleviate. I mean, that could be the difference in some people, especially mental health, between life and death.
And you're right. And, it's a lot of, you also have to look at the people that's struggling, or, they have that job where they can't take off of work, to make it to a doctor's appointment. And these are all the things that I started thinking about of how to make it easier for patients to get adequate health care, and on a timely basis, and get the care that they deserve, and especially when it's something so quick, I should say, like a UTI that requires antibiotics, or maybe a quick run to the lab to check their urine, or a cold, a congestion, something that can give them relief at that moment. These patients are being told, okay, appointments is like 2-3 weeks. So that's why that's how I came up with the telehealth service.
Got it. Now, when it comes to actually providing the treatments, are there any like new or emerging treatments that you're seeing that you're particularly excited about, whether it's on the mental health side or whether it's on the primary care side?
As far as when you say new treatments, like...
Yeah, kind of like new methods of providing care, or any type of maybe drugs, not the right word, but like I guess drugs, or like applications, like anything that you're kind of seeing, because I mean, medicine, I guess, depends on kind of how you look at it. Like, you can see that it's very slow moving, it's kind of slow to evolve, and maybe some other fields, like, you can see things moving very, very quickly as far as innovation goes.
Right.
So kind of like, what are you seeing in your field?
So I'm seeing with the COVID, I'm also getting a lot of COVID patients. They actually, taking home tests or either going to like an urgent care and, getting diagnosed with COVID. But it's very interesting that you said that because I was speaking to one of the doctors that I work for, and I believe this was a few months ago, and I noticed that a doctor was treating a COVID patient with antibiotics, and that caught my attention because I'm like, you treating COVID with antibiotics? And I just thought that was, crazy. I was like, what is he doing? So, I was talking to this doctor, and, they are treating COVID now with antibiotics. Now they're saying that the antibiotics actually can help the inflammation. So I thought that was actually it was a good learning tool. And that's the thing about healthcare. I would not go to a doctor or a nurse practitioner that claim they know everything, because you really don't. Things change every single day, and and I am not afraid to say I don't know, but we can find out together, because things change, and that's, but other than that, the lab, another innovator is how quick the labs can come in, when we send labs over to like LabCorp or Quest, we can get it dropped right into our EHR. So that's exciting because, we don't have to wait like a day or two. So, I'm liking that aspect of it as well.
Got it. Okay. Now I want to talk a little bit more about your practice. We talked about, I really want to focus on the differentiators in your practice. We talked a little bit about compared to a lot of other private practices, but also even public facilities, is that the wait time is really, really, really long, and you offer that faster service. But what are some other differentiators that you feel that in your practice compared to others in the industry?
So, of course, we talked about the quick turnaround time. The convenience. It's definitely. I have so many patients stating that the convenience of it is wonders. They love it. Also, the intake process. I find that the intake process is very user friendly. It can go straight to your cell phone, your email. And, today is the day of cell phones. Everything is done on a cell phone. So, those patients that get in that intake form on their cell phones, fill it out, send it back. It's done, So I think that is good as well, as opposed to going to the doctor's office and getting a bunch of papers and having to fill them out and taking the time to show you this. Everything gets uploaded to the EHR, so it's very quick and it's no issue. So I think the convenience of it, you can book straight through the website. So I think the convenience and the flexibility of it is what differentiates me from others.
Okay. Now, I want to talk a little bit about education-wise. And so how do you approach educating your patients about the services you offer, the benefits? We talked a little bit before about some people come in and they just kind of order, hey, this is the drugs I need, just give it to them. But I'm sure you also get a lot of other patients who come in, they don't know what the issue is. Maybe there's a little bit of fear that they have, that they don't know what's going on. So how do you approach educating your patients, just kind of from a broad view, about what you offer and how you can help them?
Right. So, it's about listening, Daniel. I listen to my patients. I like to build a rapport with them. I like to listen to their history, because a lot of times, a diagnosis can come from the history that the patient gives you. So if you take the time to listen, it also enables you to provide the right treatment, and along with their past medical history and things like that. But all of that is included in the history. So obtaining that information and educating them on certain things. Like, for example, if someone is a diabetic, not only am I going to just refill their medication, I'm going to explain to them the importance of, trying to have a consistent carb diet. I'm going to explain to them about, making sure you check your blood sugars, making sure they know the signs and symptoms of hypo and hyperglycemia. These are the things that I'm going to explain to them so that they are aware, because I find that if you are aware of these things, they'll look out. A lot of times you would be surprised, patients just don't know. They don't know why they're taking a medication. They don't know what it's for, and that's really sad. It's sad, especially with the older population. They have so many medications, and half of the time they don't even know what they're taking. So I definitely like to educate my patients on diseases, especially the chronic diseases, even acute diseases, like cold and like the flu, or when you're just not feeling well. Everybody thinks antibiotics solves everything, and antibiotics doesn't solve everything. And I try to explain to them that if a lot of times your body can fight off infections, and it don't require an antibiotic, but people feel like, oh, antibiotics make me feel better. Antibiotics is going to cure it, and a lot of times you don't need it. So it's all about educating your patient and directing them in the right way, because after all, they didn't go to school, they don't know about medicine, they don't know it. I'm here to help them and guide them through this process. So I try to definitely put education and I also send them educational material after every visit. Once I see them, depending on what the diagnosis is, I'll send them a little, educational packet so that they can read up on it. Now, if they do read up on it, I don't know, but I do send it out to them.
You brought up one point as far as you have people coming in, they're taking all these medications, don't even know why they're taking it. I'm curious, in your opinion, do you feel like a lot of people that come in that are taking lots of medications, they are over prescribed? It's like, you don't need this, you don't need this, you don't need this, or
right.
is it really they do need those medications, they just haven't been educated on why they need it? Like, what's your opinion in most of those situations?
And I feel it's a mixture of both. I feel that they may need the medication. For example, just to give you an example of what I'm speaking about. Today I had to go see some patients at a facility today, and I was actually doing endocrinology consults, checking patients with diabetes, thyroid issues, vitamin deficiencies, and things of that nature. And a few of my patients had A1Cs of like 5.4. Now, anyone know like an A1C of 5.4 is really, I don't look at that as a diabetic, but these people were on metformin, Januvia. And I'm like, why are they, at this point, you need to educate them on, lifestyle changes, modifications, as opposed to putting them on medication. People are on too much medication, and sometimes they just don't need it. And it's scary, because when you're dealing with the older population, they rely on what the provider tells them. So if you tell them they have this and they have to take this medication, they're going to stick to it, and they're not going to let any other provider change it, change that. This is what a doctor told me I need to take, so I'm going to take it. But it's a mixture of both, so and that's what makes it scary, because they don't have a clue why they're taking it. They don't know who prescribed it, and it's really scary. And that's how medication errors occur. It occur. I see it all the time,
Now, I'm sure that you get a lot of people that have some misconceptions about maybe drugs they're taking, treatments that they need, or just their overall situation. Maybe you get people coming thinking that, oh, I have this particular issue, but you find it's really something else.
Right.
So could you share some of the most common misconceptions that you get from your patients?
Yes.
Whether it's about treatments or about drugs they're taking, like what are just some of the most common misconceptions?
Common misconceptions I note that I'm noticing a trend, and it's definitely with the younger group. I'm noticing that a lot of them are thinking they have UTIs when in fact they are having sexually transmitted diseases. So they call, they make the appointment, and the first thing they say is, I have a UTI. So my question is, well, why do you think you have a UTI? And, they start telling me their symptoms, and I'm like, then, I let them speak, and, then I start asking my questions. And a lot of times they get upset with me because I just won't order them antibiotics to cure the UTI. But, based on what they're telling me, after obtaining their history, they're sexually active, they're not using protection, they're not, they're with more than one partner. And, so instead of, treating them for a UTI like they wanted me to, I tell them, you need to get tested, we need to do further testing. So I'm finding that with the younger population, and that's what, it's kind of disturbing. With the older population, I find that they just want to refill their medications, like their high blood pressure medications, their diabetes medications. They're not checking their blood sugars. They're not checking their their blood pressure. They just want to keep refilling these medications because they feel that because it's telehealth, they can just come and get the refill. But, they're not thinking that they still need to be seen, by a provider. I'm just giving you that convenience of when you can't see your primary provider, you need a refill of your high blood pressure medication, you can contact me. But these people, they thinking, oh, well, I could just go and make a telehealth appointment. You still need to see your primary provider. And this is what I try to stress them. I'm not trying to take the place of your primary provider. I'm just here to help you if you can't get into your primary provider. But that doesn't mean that you don't go and see your primary provider. And that's what I'm saying as well, too.
Got it. And kind of in that vein, how are you able to provide that relaxing, safe environment for your patients, especially when they're coming to you for something that's a little bit more personal? Maybe you're telling something they don't want to hear. And kind of even to add on top of that is that you're largely doing telehealth, so you don't have that physical environment to make them feel really safe and secure and relaxed. So how do you approach that? Like, how do you do that in that type of situation?
Just have a normal conversation with them. I have a normal conversation with them, and I make sure that my tone is very soft, and I try to give the eye contact when I'm looking at my camera. And, I pretty much let them know that it's okay. I make them feel comfortable, and that's what my goal is, So, the more you make a patient feel comfortable, it's more likely they're going to open up and they're going to talk to you. So I try to make sure my face, even though I can hear the wildest stories, I try to keep a straight face, comforting words. And I listen to them, and I'm there to help them. And then after maybe a day or two, I'll do a follow-up call with them. Hey, I'm just checking in to see how you're doing. And, and they appreciate that. So I just find that communicating with them, listening to them, and not being judgmental or oh, well, you should have did this instead of this. I try to listen, and I try to watch my wording, and I try to watch my wording when I speak with them, but still get the same thought across, if that makes sense.
Yeah. Okay, I get it. Now, my next question is what's your thoughts on what role creativity plays in how you approach patient care? Because you think about medicine, there's typically processes, there's procedures, it's been proven you follow this process, but then also not everyone has the exact same situation, the exact same circumstances. So how do you balance that creativity, and does creativity really play a role in how you approach your patient care?
Different providers do. I'm on a lot of, I would say, on social media, a lot of nurse practitioner groups and provider groups, and it's really interesting to see how we all approach things differently. And I find that, like, for example, if someone have like an upper respiratory infection, like my doctor that I work for, his take is he'll do like maybe prednisone 50 milligrams for 3 days, maybe put them on Claritin, and I may do something different. So it is creativity, but it's just, I guess, the way that particular provider wants to treat that patient. For another example, if I have a patient with an A1C of 7.2, I'm gonna try to teach them to change their lifestyle, eating better, staying away from the carbs. And at that point, with an A1C of 7.2, I may even start metformin. But then you may have another provider that may say, oh, I'm going to start them on Januvia, So I guess it's all in the provider's preference, I should say.
Mm-hmm. Okay. Now, in your experience, I'm sure that you've run across some particularly challenging cases that have come across your door. So are you able to share maybe one story of like a really tough case that you experienced, and really how you were able to get them a successful outcome in the end?
It's funny that you say that, because I actually had to deal with my this elderly lady. She called in because she wasn't feeling well. She was sick for, I would say, like a month. Wow. She said she was losing weight, lost 20 pounds. She said she was short of breath, and she just had general malaise. And she said she went to her primary doctor, and when she went to her primary doctor, when she went to her primary doctor, this lady, she was very sick. She described her symptoms. She was short of breath, lost over 20 pounds in I think like a month and a half, 2 months, very weak, fatigue, general malaise. She said she went to her primary doctor. When she went to her primary doctor, the doctor never performed an x-ray, and she told her that she had asthma and that she gave her an inhaler and she sent her home. So the lady gets home and she's not feeling well. She's very, very sick. And she calls me and she tells me everything that, I just mentioned to you. So I ordered a chest x-ray, but instead of her going to a facility to get the chest x-ray done, I ordered a chest x-ray where they can go to her home and perform the chest x-ray. Mm-hmm. And they went to her home and they performed the x-ray. I got the results back and the lady had a 6 millimeter lung mass. Oof. Yeah. Wow. So she has metastatic lung cancer, and it's nothing the doctors can do at this point. And it was a really tough one for me. Mm-hmm. That was a really tough one for me, and it's actually, I've worked in an emergency room. I have seen a lot of critical things. I have seen death, but that one just kind of disturbed me a little bit because I feel that her primary provider could have done more. Mm-hmm. I feel like, maybe it could have been caught sooner. This patient was telling me that she's been feeling like this since October, and she has been to her primary doctor like 4 times.
Oh, wow.
And I wasn't in the room when, I can't say why the provider didn't do this or do that, but, with an elderly lady of that age that's complaining of shortness of breath, rapid weight loss, general malaise, I'm going to start thinking something. And, honestly, when I did this chest x-ray, I thought maybe she had, maybe congestive heart failure, maybe COPD. I'm thinking something, maybe pneumonia. I'm thinking something along those lines. Mm-hmm. I wasn't prepared for, the lung mass. Mm-hmm. And it definitely, it spread. It had nodules in both lungs, and it was horrible. And so when I had to call this lady back to tell her this, it was really tough. It was really tough. And I had to urge her to, go to the doctor, that she had to be seen right away. And I got her into Columbia Hospital, and they took it from there, and they have been keeping me updated.
Wow. I mean, I wonder how many situations like this happen where it's a massive misdiagnosis, and it leads to this. I mean, maybe if it got caught earlier, maybe something could have been done for it. But I wonder you tell this story. I have another story. One of my friends, she used to work in the hospital. I can't remember the floor she was on, but it was basically like people who were kind of towards the end of life, but like suffering from some type of illness or sickness or something. And I remember she was telling me one story where someone came in, he was in a lot of pain, and the doctor diagnosed him, and my friend who's a nurse disagreed with it, and she's like, this is not right, like what you're prescribing to him is going to make it worse, like it's not going to fix it, it's put him in more pain, it's going to end up killing him. So the doctor's like, no, I have the diagnosis right, but she's like, no, it's not right. She kept following him, and eventually he's like, okay, yeah, now that you're telling me, like, yeah, it's the wrong diagnosis. But then he finished his shift. The next doctor came in, didn't know the situation, and so wasn't able to give the right diagnosis in time, and the patient died, like a really painful death. And it's just like, my friend told me this, I'm like, holy crap, like how do you deal with this? Like, how can you just on an ongoing, like, daily basis, you deal with things like this?
Yeah, it definitely makes you, working in the healthcare field, and you can probably ask your friend that's a nurse, it definitely makes you stronger when it comes to things like that, because you see so much, and after a while you just become numb to it, and I hate to say that, but we being in the healthcare field, we see it all the time, and we know when, like, my kids laugh at me, they're like, they come to me and they say, Mom, my arm is hurting me. And I'm like, okay, like, it's a joke with the nurses, because we're like, okay, if they're not profusely bleeding, it's not an issue here, but, a lot of times we don't, if it's not emergent, I'm not going to deal with it. And my kids get upset with me, but they come to me about everything. My stomach hurt and this and that, and I'm just like, okay, as a mother and me being in the professional, in the healthcare field, if something is really, really wrong, So I think, we do get numb to it. And, and I'm also seeing as a nurse practitioner, I'm also seeing it on the other side as well. I work as a nurse, and, we can be advocates for our patients and, we can push for them, but, we're pushing to the doctor. Now I'm on that side where the nurses come to me, and I just feel like, I listen to my nurses because I feel like nurses know their patients. If you're a good nurse, you know your patient inside out. The doctors come in, they see their patients and they're out. They depend on us for answers, And I see that now as a nurse practitioner. So I can see a lot of misdiagnoses going on with doctors because you're getting bombarded with patients. You got to have that time frame. You can't be with a patient for 30 minutes, an hour. You have to see that patient and get that patient out so you can get the next patient in. And that's why I didn't like working in primary care. It's a time frame. It's no way you can see a patient in 15 minutes, 20 minutes that they give you, document on a patient, diagnose the patient, and hear their concerns, and that's what it is. But I didn't see that part as being a nurse, because as a nurse, I could spend as much time as I want with my patient, but when you're a nurse practitioner and you're working in facilities, you have to be, you're on, unfortunately, it's sad to say, you're on a time frame.
Now, my next question kind of ties into this as far as where do you think the future of medicine is going? I mean, do you think that with either the advent of technology or maybe better training or something, that you think that these misdiagnoses will go down in any way? Do you think that there's a solution that can be put in to help reduce these cases?
Well, what I see the future of healthcare, it's good and it's bad. I see a lot of people going into nursing, into healthcare just for the money, because it's a lot of money to be made in healthcare. And a lot of times people go to nursing school for the wrong reasons, and you can't be a good nurse if you're in it for the money, because it's going to show you that this is a real career, and it's serious, and it's very draining. You got to have thick, tough skin. You got to be able to deal with stress. You have to just play so many roles, But then I see that with the technology that's coming out, the medicines that's coming out, it could be a good thing for healthcare. But right now, I just feel like healthcare is just a business, and it's not providing the healthcare that people need right now. It's more like a business. They're more concerned with surveys and goals met, and I didn't go to school for that, so I can't focus on that. I went to school to learn how to take care of patients.
Got it. Now, Tijuana, I have one last question for you, but before I ask it, I want to point people to your website at www.templefamilycare.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's looking for care but isn't sure which provider to choose?
So when I think of that, I would say that, they need to do their research. They need to understand, they need to be able to verbalize what they're feeling, their symptoms, and then they need to speak with their primary doctor. You should always start with your primary doctor, because your primary doctor should be able to refer you to a specialty if needed. So if a patient is coming in with intermittent chest pain, labs is funny, labs is abnormal, most likely they should be referred to a cardiologist. A lot of times people don't have cardiologists, so the doctor usually have cardiologists that they can refer them to. So I think that, it starts with your primary doctor, and that's pretty much it.
Okay. Well,
Yeah.
there you have it, Tijuana sharing her expertise. So, Tijuana, where can people contact you and your practice?
They can contact me on at my website, templefamilycare.com. I'm also on Google. I'm also on ZocDoc. And WebMD. And I'm on all those platforms. And all you have to do is just book an appointment.
Perfect. Well, thank you for being on the show and sharing your message.
Thank you, Daniel.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.